Good morning.
So we have a different room today. We're actually working on a real live studio because we do a lot of recording, not only for the podcast, but for a lot of things that we do here at LTI for training and coaching. So we're going to be having a real place to do this, but in the meantime, we are in a working clinic, and so there are times when we have to move around a little bit. So today we have a new room and new problems with the camera, so we've got the backup camera running, and it's going to work.
It is.
So thanks for joining us. My name is Dr. Jason Rountree. I'm the founder of Laser Therapy Institute. I'm a chiropractor and certified medical laser safety officer, and this is Christy, who is a certified laser tech. She is also the VP of Content Development at LTI, which means she is the final word on all of the online learning courses that our doctors get to take, which means I can blame her for everything. No. But she's got a wealth of experience and history in building online courses and also now in laser therapy as well. So thanks for joining me, Christy.
It's always a pleasure. Thank you.
This is our Laser Therapy Institute podcast. This is targeted at healthcare providers. Of course, if you're not a healthcare provider, you are certainly welcome to stick around. We'll probably say a few words that don't make a lot of sense, and that's okay. We're still going to try and make this really friendly to everyone out there, but of course, really aiming it at other healthcare practitioners in the field. And this is probably the second biggest topic when it comes to light therapy that we talk about. I'd say the number one is probably neuropathy, nerve pain,
right,
and nerve damage. But this is dementia, and I think it really
hits home for a lot of people.
Yes, yeah, it does, and more every year or two. They say in this study actually that the number of persons with Alzheimer's disease, which is the most common form of dementia, is expected to increase and escalate dramatically in the coming years with the aging of the baby boom generation. In 2019, there were an estimated 5.5 million Americans living with Alzheimer's disease, and that's projected to reach 13.8 million by the year 2050.
Wow.
There's other types of dementia as well, of course, but Alzheimer's most prevalent, one that really gets a lot of attention. You have, of course, Lewy body disease and Parkinson-related dementia as well. Those are certainly in the same category, but for a lot of people, like you said, Alzheimer's kind of hits home, dementia.
Yep.
So the study that we're going to be looking at today, as we talk about dementia and light therapy, is titled Transcranial Near-Infrared Light Stimulations Improve Cognition in Patients with Dementia. So transcranial meaning through the skin, through the skull, right through the cranium. Near-infrared light, we know that's an invisible type of light that is just past red before you get out to things like radio waves on the electromagnetic spectrum. And then the word stimulations here is, I paused on it, kind of funny because it's an awkward way to put this, but really we need to understand that when we're talking about using light is an energy source. It is not just something that you encounter every day that helps you see what you're reading. It is an actual energy source. Now, most of the time, your ambient light, like this light in this room, is very, very, very low. It's really got minimal effect. And it's in a visible spectrum in a lot of cases, which means it has really no effect on anything outside the surface of the body.
Right.
But this near-infrared light does pass through the skin. And, as they say in here, in its title even, can pass through the cranium, which is very thick bone.
And that just is still so fascinating.
Yeah.
Just passing through bone, it actually does. And it targets what you're targeting.
Yeah. Yeah, that's one of the really amazing things. And it's been well researched and proven at this point that that's entirely plausible and possible and does happen. So this word stimulation zone means that this energy, light energy, can stimulate the natural biology, the cells of whatever your target tissue is, which is why the new term for light therapy or laser therapy is photobiomodulation, using light to stimulate the biology of the body. So we still say laser therapy here at Laser Therapy Institute because
it's easier for one.
It's easier. Yep. It's a little bit catchier, and in most cases, most clinicians are going to be using laser for a very long time, and LEDs as well can work just fine for light therapy, but lasers give a clinician more flexibility and more capability, and so that's what we usually see clinicians using is actual lasers. So that's the title of this study that we're looking at today. It was published in July of 21 in Aging and Disease. Baylor University hosted this one. A nice number of researchers on here that put together quite an interesting, fairly large-sized study in respect to what we normally see with photobiomodulation studies. So I'm going to dive right in. We'll go through what they did, and then we'll talk about what it means to you as a clinician here as we go.
Sounds good.
So they say that light, near-infrared light specifically, with LEDs, can efficiently penetrate the skin and skull to reach the brain parenchyma. It exerts an anti-inflammatory function and through regulation of beneficial regulation of pro and anti-inflammatory cytokines. It also stimulates and promotes synaptogenesis and neurogenesis through activation of brain-derived neurotrophic factor. There's a lot more details here. I won't go into all of them, but just understand that this deposition of energy going into the tissues of the brain stimulates some of these natural mechanisms through the body's own way to do this. So we're not burning or cutting or heating tissue. The heat, if you experience warmth with light therapy, the heat's not doing anything. That's not our goal here. The goal is to deliver these photons, these little packets of energy, to the target tissues. So, if you want to know more about this, definitely look up the study. Again, the title is Transcranial Near-Infrared Light Stimulations Improve Cognition in Patients with Dementia. And
we'll provide the link in the podcast notes.
Yep,
so
absolutely. And the study was, I really like this for a number of reasons. It was placebo-controlled. They had 57 participants that completed the study. They started with 60, so they only had 3 dropouts.
Wow, impressive.
And it is. Those are good numbers. And the 3 dropouts were unrelated to anything with the actual study. It was other health concerns that had those patients drop out. So,
okay.
I mean, that right there I think is really pretty amazing. So they took 57 people total that made it through that were in early to mid-stage dementia. So no severe cases, early and mid-stage only, and folks that were otherwise healthy. Not a lot of complicating factors.
Okay.
So patients were between 50 and 85 years old. They were evaluated with a pretty standard neuropsychological battery, which included the mini mental state exam. That covers orientation, word recall, copying skills, things like that. And ADAS COG, which covers word finding ability to comprehend, word recall. The clock drawing test. Clock drawing test is a very, very classic test for those with dementia. It's very, very difficult for folks with dementia, even early onset dementia, to be able to replicate a kind of analog clock drawing. If you've been in memory care, you've seen this a million times. If you're new to it, that clock drawing test can be really remarkably difficult. So they also tested number sequences, trails A and B testing for visual motor coordination, and then story recall after a 30-minute delay. The nice thing here too is they also included findings from the caregivers.
Okay.
And those who are caregivers, the partners of folks with dementia, have to undergo a lot of stress.
They do. Yeah. And it can be wearing on them as well.
Absolutely.
Very wearing.
This study, these researchers really took a lot of, took a pretty good section of this paper to talk about that and how important it is for caretakers to be able to have, kind of more regulated, less difficult lives themselves as they're trying to care for these dementia patients. So they did take this into account, including sleep-associated findings. So the caregivers had a daily log and feedback notes, and so half of the participants got a sham device that was turned off, but otherwise completely functional. And then the other half, the active arm, got an active hand. It's actually a helmet. I've got a picture here. I'll show you. It is quite interesting. hide us. There we go. So this this device is something you can look up. You can find the Cognitolite. You'll notice on the front there, it actually has two little kind of dangly parts, right? Those fit over the eyes, which I find is really interesting. So you've got this just sits on the head, and then those two pieces kind of fold down into the eyes.
How's it? It's providing laser through the. I mean, I know we talk about eye safety with laser therapy. Is it emitting light through that?
It is emitting light, but that's the difference here. This used LEDs instead of lasers. So, because it is non-coherent and non-collimated light, that's directed in one specific direction, like lasers are, LED light at low enough power densities is safe over the eyes.
Okay.
So that's what that looks like. It's not clear to the United States. If you wanna try and find it or whatever you can, it's a little more than $5,000 US. So significant investment for people for sure. But I think you're gonna like what they found here. So the treatment was they used that headpiece, that helmet. Stand by. There we go. They used that helmet twice a day for every day for 8 consecutive weeks. So that is a lot of treatment.
And how long were the treatments?
6 minutes a day.
Okay.
Or sorry, 6 minutes twice a day. So total of 12 minutes a day, every single day. The great thing with this is that they did it at home, so it was a lot more tolerable because you didn't have to go somewhere and get the treatment done. That particular helmet has 12 cranial modules. It have 1060. It's actually, because it's a LED, it doesn't give you one single wavelength like a laser does. So in this case, it produces somewhere in the 1060 to 1080 nanometers. So a little bit further into the infrared than we've seen a lot of other studies. Total power that the helmet generated was about 15 watts at a power density of 23.1 milliwatts per centimeter squared. So a decent amount of power, but spread out over a large area so that it was a low enough power density or irradiance so that it was not overheating or uncomfortable at all.
Okay. Interesting.
Very interesting. Yeah, this helmet's actually been, I guess, in development for a number of years, but we're not seeing it here in the U.S. Yet, as far as I know.
Where is it being used?
The UK. It was developed in the UK and has been studied there. I'm not exactly sure. I wasn't able to figure out if it is actually cleared for use in the UK or if it's all still in the experimental stage. So somebody let me know. Drop a comment. Send us an email if you want to. info@lasertherapyinstitute.org. Let us know what you know about this particular device. Again, expensive, and you have to use it a couple times a day, every day. But let's talk about the results, because the results are quite impressive. They said that in the active arm only, some patients appreciated longer and more peaceful night sleeps. Duration of sleep increased by 1 hour on average after the first 6 to 10 days of the treatment. In some patients, recurring nightmares ceased. Patients reported being more energetic, more physically and mentally engaged in daily living. And the caregivers also noted patients had less anxiety and improved mood and energy and better daily routine after about the 2 to 3 week mark from beginning treatment. That was all not noted. That was not noted by those in the placebo arm. So by either the patients or the caregivers. So pretty clear difference there. And that was kind of some of the generics. But they say that as we look at the sub-tests from different individuals, outcomes are even more exciting over only this 8 weeks of treatment. One participant with moderate dementia achieved a 75% improvement on the mini mental status exam. Another patient had an 80% improvement in the clock drawing test. 2 patients had a 60 and 80% performance improvement in the clock copying tests. 2 patients had 12-point and 13-point improvement in logical memory, immediate and delayed subtests. And executive function improved by up to 73% in some patients. Verbal learning and memory tests improved by up to 35%, as shown in the active verbal learning, immediate and delayed tests. So these were all things that were not seen in the sham-treated group. So I think that says quite a bit. Those are all very significant
Very
numbers.
significant numbers. Yeah.
It does also indicate that people do respond differently.
Right.
So, in general, the worse the dementia, the less we would expect. But also, just because someone is in that moderate category doesn't mean they're beyond hope. They can have some very significant advances. And again, this is just over 8 weeks. They didn't even start seeing some of the results until sometimes as late as 3 weeks into treatment.
Because we know, a lot of times laser therapy treatments are not immediate. In some cases, depending on the condition, you see significant improvement very quickly. But sometimes in your clinical experiences, it does take time for more results.
Yes.
So 8 weeks to see that kind of significant improvement, that's amazing.
It really is. It really, especially, they just cleared another drug. FDA just cleared another drug for dementia, and it is shown to moderately decrease the speed of decline. But these guys are reversing it. We're actually having improvement. We're not just kind of decreasing
just slowing
how bad
it.
people are getting, like how fast people are getting bad. And I keep bringing this one up, but Aduhelm is another drug that was cleared last year. I believe it was last year.
Mm-hmm.
It's an IV drug that has to be delivered every month for the rest of the patient's life, and it's not even proven to improve anybody.
Wow.
And it costs taxpayers over $50,000 a year to pay for that to be done. So this device might be expensive. A laser therapy device for you in your office might be expensive, but the payoff is huge, potentially huge. Now, we don't have long-term follow-up on this.
Right.
After the 8-week mark, that was really it. But I think we're going to be seeing more and more studies that show kind of some long-term effects and the ability to maintain these kind of gains in these patients with dementia, and it's going to change people's lives.
Yeah. What about some of the protocols that you've been using? Would they translate into this?
Yes. And again, to emphasize, there are differences from patient to patient. Not every single patient is going to have an 80% improvement on these tests. And even in this particular study, not every single patient improved in every single category. Right? Even with active treatment. Sometimes they only improved in a couple of categories. So the takeaways here are that it does work. It just works differently for individual cases.
And that's to be expected.
It is.
That's to be expected.
We're all individuals, and this disease process is very individualistic.
Right.
Even the time from onset to mid-stage dementia can be vastly different from patient to patient. You can have somebody who goes from completely fine to severe dementia over just a period of months. And you have others that it's been going on basically undetected for years before they finally get a diagnosis of like early cognitive impairment or decline, and then years before they're even really in what they would really truly call Alzheimer's.
Right.
So it's going to vary per patient, and the comorbidities matter. Are they diabetic? There are so many different factors. So that's your number one takeaway that I'd like you to leave with today, is that photobiomodulation does work. It does work for these dementia patients. You can't overpromise results. We don't know what the long term looks like as far as maintaining these results, but like they said in this paper, absolutely no side effects, no adverse events. That's amazing for any kind of treatment. Name a medication that doesn't have a side effect or an adverse event associated with it.
I can't.
No.
Not even ibuprofen.
No. Oh yeah, that kills thousands of people every year. So it's amazing where this field is going. It's really exciting to see these papers come out. As a clinician, remember that it does take time to get these kind of results. It does take repetition. Don't shy away from treating somebody because you treated them 4 times and didn't feel any different.
Right.
You don't expect them to, right?
No.
Give it time to work. Give it time, and talk to the patient and the caregiver about that too. It's going to take time to see the results. They need to track the results. These patients, caregivers, kept a daily log of not only doing the treatment, but how the patients were sleeping, how their mood was, how they were eating, their daily routine, normal things like that. They kept track of that in order to be able to go back and see how things had changed, because this is a gradual change over these weeks.
Mm-hmm.
It's notable, it's noticeable, but it does take time.
Well, the record keeping is critical because you can have a patient say, "Oh, I don't feel any different," but you can prove that things have changed.
Yeah, absolutely.
So,
we actually had a patient just last night who came in for her, I believe it was her 5th treatment. Right, it's very, very, she's on her 2nd week of care, and it's just a very simple elbow irritation problem for this patient. And she goes, "Oh yeah, I'm a little bit better." But we had her fill out outcome assessments, which give us an idea of how well she's functioning. And she had insanely good improvements. So we had to show them to her, like, "This is what you're saying." She goes, "Well, I was answering them the same way I did, a couple weeks ago. So yeah, that's amazing. I didn't realize I had improved that much." So sometimes really keeping track of this stuff can really show the differences and if somebody is responding. Of course, if somebody's not responding, for a dementia care plan, within about the first 6 weeks, I would say 6 to 8 weeks, somewhere in there, you probably should consider discontinuing or changing your strategy or including maybe something else in the treatment. I'm not saying give it forever. Don't treat it for 6 months and be like, "Oh, I guess it didn't work." Have some goals there, but do give it enough time. And also, don't shy away from effective home devices. A device like this one I don't believe is available yet here in the U.S., but it might be available in other areas. There are some other devices out there that might work. Do be cautious. Make sure that you verify how well these devices work. Make sure they've been included in studies like these. Make sure that it's not just the manufacturer's claims as far as power and specifications go, because there's a lot of devices out there that are much cheaper and deliver almost no light. They're really worthless. But for the effective units, don't shy away from maybe sending a patient home with one. We got a comment that says, "I think laser might be more convenient." Absolutely more convenient for a clinician, that's for sure, especially if you're keeping track of this patient.
right.
So what we often see in practicing with LTI protocols is we will treat these people maybe 3 times a week. It's really not that inconvenient, and they do make very, very good improvements. If you could also include an at-home device, especially for the maintenance, once you get that improvement, that's probably a great idea too.
Right.
But that, exactly like we said at the beginning, we like lasers for clinicians because you have so many options. You can take the same device you use for lateral epicondylitis on the elbow and turn around and use it effectively on the brain, and then turn around and use it effectively for wound healing. There's just so much flexibility.
Right.
Whereas, a helmet like this is great, but
Very limited.
Very limited. That's all you're going to really use it for is brain care.
Right.
If you have questions, if you have comments, if you want to reach out to us with something you might know about this device, please do. You can email us, info@lasertherapyinstitute.org. If you want to find a laser therapy provider for your patients, maybe that are in other states or elsewhere, go to our website. Also, we have a clinic locator. You'll be able to find a laser therapy provider near you. If you are a laser therapy provider and you want to be on our map, there is a way you can add yourself to our map for free. Encourage you to go and do that. And if you want to know more about how to use laser therapy effectively, how to set up your program so that you can help patients with results like this, how to get the settings correct, the parameters on your light device correct, let us know. That is the thing we do. We provide training, we provide settings, we provide protocols, all for clinicians who are using light and laser therapies in office. Thanks for joining me.
Thank you.
See you in a couple weeks.
Sounds good.